Hi everyone. Today I would like to talk about the skill of empathic listening for all healthcare professionals, be it a doctor, be it a nurse, be it a healthcare assistant, be it a support worker, because we cannot talk about achieving person-centered care without mentioning the skill of empathic listening. Empathic listening involves not just hearing what the patient is saying, but trying to understand the patient's concerns, their emotions, and their perspective. Empathic listening is very important for the various reasons. Number one, improve patient outcome. For example, if I'm a patient and I feel heard, I feel understood, I feel supported, I will most likely adhere to my treatment plan, and this is going to help to achieve a positive health outcome for me. Number two, empathic listening helps to build trust between the healthcare professional and the patient, and this is going to foster a positive therapeutic relationship. Thirdly, listening to a patient empathically helps you to gather comprehensive first-hand information, which is going to help in making informed decisions. What do I mean by this? Gathering this first-hand comprehensive information will help you to make decisions based on the patient's needs and not just based on what you think the patient needs at that point in time. Again, empathic listening helps to provide support to the patient. That is, it makes the patient feels involved, it makes the patient feels listened to, it makes the patient feel satisfied. Listening will also prevent misunderstanding between the healthcare professional and the patient, because if I'm able to listen to you empathically and I'll be able to understand your needs, and therefore it's going to avoid unnecessary errors and in diagnosis and treatment of my condition, and also everything you'll be doing will be based on my needs. In order to effectively practice empathic listening, number one, put yourself in the patient's shoes when communicating with this patient. Try to understand their emotions, try to understand their perspectives, and try to understand their needs. Secondly, avoid showing judgmental attitude towards the patient. Create a supportive and safe environment where a patient can express their needs, express themselves openly without the fear of being judged by you, the healthcare professional. Thirdly, pay full attention to the patient when communicating with them without interrupting. Ensure eye contact, and also make sure that your non-verbal and verbal clues shows interest. For example, make the patient feel like you are actually involved in whatever they are telling you. Make them feel comfortable so that they can express themselves openly without feeling like they are being neglected or you're not listening to them. And lastly, use a simple, respectful language when communicating with the patient. Avoid medical jargons, because there are some terms that you understand as a healthcare professional, whereas a patient will not understand those terms. So try as much as you can to simplify whatever you are trying to ask the patient, tell the patient, so that they understand whatever you are saying. So this skill is very important for all healthcare professionals. Like, we always try to prioritize our patients and make sure everything we are doing, they are at the center of it. So if you are able to communicate with a patient empathically, that is already a step forward towards achieving person-centered care.